going to turn now to topical questions. We have one topical question today from Joan McAlpine. Ms McAlpine.
Thank you very much, Presiding Officer. To ask the Scottish Government what its response is to figures published by the Scottish Learning Disabilities Observatory, which state that people with a learning disability are 3 times more likely to die of COVID-19 and twice as likely to experience serious disease.
Minister Claire Hawkey.
Scottish Government thank the Scottish Learning Disabilities Observatory for completing this important research, which helps our understanding of the impact of coronavirus on people with a learning intellectual disability. The study evidences that there were 36 deaths of people with learning disabilities during the first wave, and the SLDO's own position has been to be cautious in interpreting the data due to the very low numbers involved. However, I want to stress that I absolutely recognise these figures represent unique and irreplaceable individuals whose loss is mourned by many, and I offer my sincere condolences to all who have lost a loved one. We understand and recognise the anxiety among the community and the call from SLDO and other charities for all people with learning disabilities to be offered vaccination. We continue to work closely with SLDO to consider the implications of this research and any necessary action, as well as further research. Scottish Government will remain guided by the recommendations of the Independent Joint Committee on Vaccinations and Immunisations, who are advising on a 4-nations basis. Our Scottish data supports the conclusions already made available to the JICVI from similar research carried out in England and Wales relating to people with learning and intellectual disabilities. However, the JICVI will continue to analyse emerging data, and we will ensure that the SLDO's data is made available to the committee through our Chief Medical Officer. In the meantime, Scotland's COVID-19 vaccination programme continues to gather pace, and led by the JICVI guidance on vaccination prioritisation, people with Down syndrome are currently invited for vaccination during Group 4, and people with severe and profound learning and intellectual disabilities and carers will be offered vaccination during Group 6. Our Roll Up Your Sleeves campaign encourages everyone offered the vaccination to get it, as it's the best way to protect yourself and others and the NHS from coronavirus. In community settings for people with learning disabilities, routine weekly testing is available for all care home staff in Scotland, and we're now using a mixture of testing to allow us to regularly test care home visitors, care at home staff and all patient-facing healthcare workers. And as of January the 18th, we've expanded testing to all care at home and day services, all permanent and visiting staff and personal assistants to both the person's own home and where a person's home is within a residential setting or sheltered housing complex, as well as staff who work in adult day centres. They are now being regularly tested.
Joan McAlpine.
I thank the Minister for that answer. Of course, Public Health England last year found that people with learning disabilities had a mortality rate 6 times higher than the general population. So there is a body of evidence already that this group is very vulnerable. People with severe and profound learning difficulties, as the Minister said, are currently in priority Group 6 for vaccination, but people with mild and moderate learning disability have no prioritisation, even though the higher mortality affects them too. The Scottish Commission on Learning Disability issued a statement saying that the easiest way to protect the group is to ensure that all are prioritised for the vaccine. Will the Government act on the Commission's recommendation? And more broadly, given the growing amount of research, including the latest research on mortality figures, should they be higher up on the JCVI priority list for vaccination, given that they already feature on the Green Book table of clinically vulnerable people?
Minister.
I thank Joan McAlpine for her question. Scottish Government will remain guided by the recommendations of the Independent Joint Committee on Vaccinations and Immunisations, who are advising on a 4-nations basis. It's for clinicians and experts within JCVI to analyse emerging data and make recommendations. However, we will ensure that the SLDO's data is made available to the committee through our Chief Medical Officer. Some people with mild and moderate learning disabilities will be eligible for priority vaccination if they have co-occurring underlying health conditions or are over the age of 50. And we are continuing to work with the NHS Scotland to ensure everyone who is eligible for a priority vaccination is invited to receive one.
Joan McAlpine.
Thank you. The statement from the Scottish Commission on Learning Disability points out that GP records may not accurately identify people with a learning disability. For example, these records don't actually tell you if someone has severe or profound learning disabilities, so they may not get the vaccination prioritisation that they need. So the Commission say that people need clear guidance on what to do if they don't receive a vaccination when they should, or if they are not identified on GP records. And the Commission's statement also says that reasonable adjustments must be made so that people with a learning disability can receive the vaccine in a community setting if need be. Will the Government act on all these recommendations from the SCLD?
Minister.
So we're continuing to work with health boards on ensuring everyone who's eligible for a priority vaccine is invited to receive one. Local health boards will contact individuals to arrange a vaccination appointment when they are eligible. However, if anyone is concerned that they haven't received an invitation and they think that they should have, I would encourage them to contact the National Helpline on 0800 030 8013. We are continuing to review our vaccination delivery strategy on a rolling basis to ensure equitable access for all of those eligible for a priority vaccine.
Thank you. And Rachel Hamilton.
Thank you, Presiding Officer. We know that loneliness and isolation is increasing as lockdown restrictions continue, especially for people with learning disabilities. The Red Cross report entitled The Longest Year states that nearly 1 in 3 Scots say they are not confident where to go to access mental health support, and almost half say it's difficult to talk about their problems. What action will the Scottish Government take to ensure people can access the practical and emotional support they need?
Minister.
I thank Rachel Hamilton for that question. I think we all absolutely acknowledge what she's saying, and that people have been feeling more isolated and more lonely given the necessary restrictions of lockdown. Scottish Government provided an additional support of £445,000 to National Autism and Learning Disability charities to help them deliver their critical frontline services to support people who are struggling as a result of coronavirus COVID-19. And this included specific funding to Down Syndrome Scotland for advice on children wellbeing and mental health, as well as funding for Enable Scotland to deliver a programme to tackle socialisation, digital wellbeing and counselling support delivered through PAMIS. And since the start of the pandemic, we've been working in close partnership with the Scottish Commission for People with Learning Disabilities and People First to create easy-read versions of coronavirus guidance and information, which is available on NHS Inform and gov.scot.
Thank you very much. And that concludes topical questions. We're going to move on